I would worry about an unhealthy population.
We are not in the luxury of having unlimited resources.
Will the people be able to come to work the next morning?
The biggest risk that we face is doing harm to our beneficiaries, worst case scenario, fatalities.
If we don't have a health sector that can accommodate the health needs of the population, then we are putting the workforce, the main workforce of the country, into a bracket where it is an unhealthy population. Now that affects every aspect of our economy.
I think the first thing I would worry about is our people. Will the people be able to come to work the next morning? How will our people support? Because the systems and processes are static in a way that they will not change because something has gone wrong. But how will our people, will they be able to come to work and will we be able to do the work that has been set out for us?
So when things go wrong, I will worry more about the vulnerable populations, the women, the children, the people living with disabilities, and people living with many chronic diseases.
Worst case scenario, fatalities. So we absolutely categorically have to avoid that, and we need to strengthen our supply chains to ensure that the cold chain is not broken at any point. The last mile is also really important, so investing in local ministries of health and strengthening their capacities, or the local actors, whoever it is that's doing that last mile delivery, and giving those items over to the beneficiaries.
When people had to choose, do I distribute PPE or do I distribute family planning, do I distribute immunization? PPE is what got the priority, so things did go wrong because we weren't able to adjust to a new health priority while maintaining some of our existing priorities.
We are not in the luxury of having unlimited resources. We are always struggling between having more people in need and less resources available. So to match the difference in both of them, we need to rationalize, we need to optimize. So if we don't invest in supply chain resilience from now, we are going to have costly operation reaching less people, and then we are not doing our function and not doing our job in an efficient way.
If things went wrong, I would worry about the money, the time, the resources we have plugged into health supply chain. That could have been plugged into agriculture, that could have been plugged into education. But we invest in health supply chain because we see an end to a woman putting to bed dying just because she does not have access to oxytocin.
Supply chain does not work in isolation. It has to be integrated into the organization, the entire organization. There has to be an integrated approach to business, supply chain, finance, the doctors, set up systems that are seamlessly integrated so that if you're working in a hospital, the doctor, before he prescribes, can go into his system and know whether this item is available and in what quantity it is. So that you don't prescribe for the patient, and the patient struggles in their illness, goes to the pharmacy and finds there are no drugs. So for me, it's a complete malfunction of our entire system, health system.